My name is Esther O Brien. I'm a clinical nurse specialist and I'm a member of the Specialist Palliative Community Care Service here in Milford Care Centre in Castletroy, Limerick. I believe palliative care is the journey we make with our patients and their families. When we receive our patients into our care, we have no control of the outcome, but we can accompany them on that journey. And we give our clinical expertise as a member of a team, but also the extras we offer are that support, that enabling them to finish that journey on how and where they want it.
So we work with patients of any age and any stage of their disease trajectory, and we would work with them to try and self-manage their condition, alleviate any fears that they may have, make them as independent as they can be, and that might include providing them with some equipment to help them. And we speak with them and their families to try to ensure that they are comfortable and that they can achieve any goals that they may have. Sometimes patients can be anxious, and we can provide them with education and support and self-management skills to try and alleviate their symptoms. And we are a source of contact to the patients from the hospice, and I suppose as a support to them. Everybody's needs are individual, and so we as a team of occupational therapists, physiotherapists, social workers, nursing, we'd all work together collaboratively to try to provide a service specialised for that patient, and we would work with the patient and their family to keep the patient as autonomous as possible in the process, to ensure that their specific needs are met by us. I work particularly closely with the occupational therapist. We might go out to their house together and do an assessment and provide some equipment for the families to make sure that the patient can be as independent as possible and have the best quality of life.
So part of my role as a specialist palliative occupational therapist is helping patients and families identify and achieve goals, meaningful goals to them. Also, part of my role is helping them to optimize or maintain their function and independence, either through education or through provision of compensatory equipment. Also, I help in the terms of management of symptoms, fatigue management, pain, breathlessness management, and anxiety and stress management. So I had a patient who, when he was first diagnosed, himself and his daughter bought this Ponnell tunnel. But unfortunately, towards the end of his prognosis, he wanted to go out to Ponnell one last time. So in order to achieve this, I provided a supportive wheelchair, assisted the family in terms of transfers, and he achieved his wish of going out to Ponnell tunnel one last time.
This gentleman, on my first visit, he'd been given a diagnosis where there was very limited or no treatment options at the time. On my first visit, the introduction of palliative care was another shock to him. So he was appropriately sad, fearful of the unknown, and then tearful. And in the presence of tears, there are no answers. There's no answers, so there's that moment of silence. And while we were sitting in that moments of silence, the dog came out from under his chair and jumped up on his lap and put his two paws on his shoulders and gave him a little lick. And that's the essence of it, you know, that compassion, that care, that being present, that is the essence of palliative care. The rest follows on. That began our journey, and it was a very special journey for all of us. The gentleman came to accept leaving his beloved family, his beloved wife and daughters, and his dogs, and died peacefully.
So when we go to see somebody and they're fearful about palliative care, we would always explain our role and the range of options that we can provide and the support that we can provide, so that the patients and their families are aware, because sometimes there's something that they didn't even realise we could help with.
The promise is we are there for you. We'll provide all the care that is needed, the symptom management, the support, to the very end where it's needed to be and beyond.